Hi folks, I'm Dr. Ed Beyer. I'm a chiropractic physician here in Tinley Park, Illinois, and I'm making this video today to invite you to a very important workshop I'm going to be holding personally in my clinic in Tinley Park this upcoming Tuesday. It's going to be on type 2 diabetes. It's so prevalent in our society today, and there's so much misunderstanding about type 2 diabetes. Folks, type 2 diabetes can be reversed despite what your medical doctor may be telling you. And what I want you to understand, and what I'll be sharing with you at the workshop, is there are many, many reasons besides diet and lack of exercise that can impact your blood sugar levels. Thyroid function, adrenal function, liver function, gut function, different nutritional deficiencies that we see over and over and over in our patients with type 2 diabetes, that once we identify and correct them, their blood sugars plummet and we're able to get them off their medications. I'm also making this video to share with you an actual case study of Frank, a 68-year-old male who came to see me. Here's Frank's story. We're ready.
Okay, my name is Frank. I'm 68.
Frank, how did you first find out? What brought you to our office?
I read about your seminars in the newspaper.
Which one in particular?
Yeah, Southtown.
Okay, no, what was the seminar on?
Oh, the seminar was on diabetes too and peripheral neuropathy.
Okay, and that obviously stoked your interest because you were diabetic, type 2 diabetes.
Right.
What kind of medication were you taking when you first came in?
When I first came in, I was taking Lipitor, 40 milligrams of Lipitor. I was taking glyburide, metformin, 500 milligrams. I was taking, trying to think of the other one that I'm taking. Lisinopril is
The blood pressure.
5 milligrams.
The metformin, you were taking 2 of those, right?
Two a day.
So 1,000 milligrams.
1,000 milligrams a day, yeah. And
Okay.
Metformin glyburide is 5 milligrams of glyburide and 500 of metformin.
Okay, and you also did have peripheral neuropathy in your feet?
Yes, I did.
Correct? Okay, so that was another reason why you came in.
Yeah.
Okay, now we're wrapping things up today. Okay, we found a lot of different things on different tests, correct?
Yes.
Now, your blood sugar, your fasting blood glucose when you came in was what?
188.
188. Now, typically now, what is it in the morning when you first get up?
Well, when I first get up, it's usually around 100. Or under 100. My 7-day is 101. My 30-day is 100.
Okay, and are you taking the same amount of medication right now?
No, I'm taking half of a pill in the morning and sometimes a half a pill at night, about half of the time taking one. That's a half at night.
So that's pretty much cut in half?
At least cut in half, more than cut in half.
And we know that if you continue doing the things that you've learned here, that we're going to eventually get you off that.
That's correct.
How much, now the peripheral neuropathy, how much have your feet improved?
Well, I would say my feet have improved dramatically. As a percentage, they're at least twice as good as they were before. I don't know how to pretend a percentage, 50%, 100%, I don't know.
Okay.
They're much better now. I have a little bit of neuropathy in the morning only, and within half an hour it goes away.
How about your energy levels and just overall how you feel?
Energy levels are up, and overall I feel much better.
Okay, and we're actually you're pretty much not totally done with it. We're coming down the end of your treatment here, which is about what, 18? How many weeks? 18 weeks.
Well, it was originally supposed to be 18 weeks, but we condensed it a little bit because we did the 3 a week for longer than necessary.
Okay, but like I explained to all my chronic patients, it's going to take a good 6 to 12 months for your metabolism to stabilize, but you pretty much don't need me anymore, okay?
Well, let's hope so.
Now, we found on your testing, in addition to the blood work, we found some other issues, correct?
Correct.
And pertaining to the gut, what did we find?
A couple of yeast infections and a non-human parasite.
Okay.
Whatever that is.
And we're in the process of getting rid of those.
We're killing those now.
And then we found some food sensitivities, correct?
Well, you said I have 2 markers for gluten sensitivity.
Mm-hmm. Okay.
But my gluten test came in under the
reaction, right? Okay. So overall, this route of handling type 2 diabetes would you recommend it to people who want to really take control of their health?
I read in various places and send Dr. Beyer articles about this, and I read about people taking 2,000, 5,000 milligrams of various drugs, metformin, etc., and not getting any better. And I believe that what Dr. Beyer is saying works.
Okay, thank you. Now, we were about halfway through with Frank's care for the type 2 diabetes. We were completing his care for the neuropathy that was a consequence of his type 2 diabetes. But that's a classic example of someone who, once we identified what was really causing his underlying blood sugar to be elevated, that not only his nerves got better, but he was getting off his medications, energy levels were up, he was losing weight, and on and on and on. Folks, you have one life to live. You got to ask yourself, do you want to spend it with this condition? You don't have to. And that's what I'll be explaining at my workshop. This could be the first step you make in getting your life back. I hope to see you there.